just about a few seconds and I'll let you know when to start. Good afternoon. Thank you for joining us for this first virtual broadcast of our daily Riley County coronavirus response updates. My name is Vivian Uccello. I'm the lead public information officer for the incident. Today, as always, we are going to have a couple brief statements, first from Julie Gibbs, our local health officer, and then from Kurt Muldrup, Assistant Director for the Riley County Police Department. Please excuse us, we're all working remotely. If there are dogs barking or other distractions, we appreciate your patience as we deal with that and resolve any technical difficulties that might present themselves for this first broadcast. The public will have the opportunity to ask questions. I'll be on my phone here monitoring the Facebook Live feed. We have about a 30-second delay, so again, please bear with us. And with that, I will turn it over to Julie Gibbs. Thank you.
All right, thanks, Vivian. Hi, everyone. I've been giving daily updates now for almost 2 weeks, and I usually start with statewide and county updates as far as numbers, and that is not always good news because those numbers continue to increase. So today, instead of starting with those numbers, I'm going to start with a little lighter message. I just wanted to remind everyone that there is light at the end of this tunnel, and we will get through this. There are a lot of positive messages floating around on social media, by word of mouth, with people's actions, and also things that you see on the sidewalk that are written in sidewalk chalk. I love to see these messages, so please keep this up. We need to take our minds off of COVID for a while. I encourage everyone to have conversations that are not centered around the topic of COVID-19. Get off social media for a while, not right now, but in a little bit, and turn off the news for one day. And overall, just try to really think positive. We will get through this. Okay, now for your update as far as numbers. As of today, April 2nd, Kansas has 552 positives statewide with 13 deaths and 138 hospitalizations. Riley County now has 8 positives. The most recent we just learned about this morning. We know that the last 2 individuals, a male and a female, were both in their 40s and both had traveled. We are currently in the process of finding out more information and have begun our contact investigation. Currently in Riley County, we are monitoring 28 people, and we still have 9 tests pending, and this includes tests pending at Fort Riley. And we have a total of 70 negative tests so far in the county. Remember, if you're experiencing symptoms, please call our screening line at 785-323-6400. We have healthcare professionals that manage that line every day, 8 a.m. until 10 p.m. So if you're experiencing symptoms such as fever, cough, or shortness of breath, please call that number. Again, it's 785-323-6400. We have a lot of generous people in the community, and we're very thankful for that. Please know, however, that we can only accept manufactured items in regards to personal protective equipment. Please no handmade or homemade items. If you would like to donate medical items, please call 785-587-5462. Again, that's 785-587-5462. Please keep up the positive messages. Remember to check on your neighbors. Above all else, stay at home unless you need essentials. We continue to monitor the situation on a daily basis through our EOC, and we are confident that we are ready to handle any emergency situation should it arise. I have every confidence in my team, in my community members, and certainly in my community as a whole. And I will now turn it over to Kurt Muldrup.
Thank you, Julie. Yesterday, we talked about the need for the businesses to comply with the governor's executive order 2016. We said that we'd be making contact with a few of the businesses that were not exempt under the KEF, but were open. Well, today an officer with the Riley County Police Department met with a small number of businesses to deliver the notice to close form. And I'm pleased to say that each business was cooperative and very understanding. I'm not saying that they were not disappointed, but they did understand. And I think that speaks volumes about their desire to support and promote the safety of our community. So I want to thank them and all the businesses that are sacrificing for our community. If a business or a community member has a question regarding whether a particular business is exempt under the Kansas Essential Functions Framework, or KEF, as laid out by the governor's executive order, they should email rileycountycovid19@gmail.com. And the EOC will make a determination along with the local health officer, Julie Gibbs, and then take appropriate action after that. And that is all I have.
Thank you both. Becky and Haley, do you have any questions, or would you like me to go ahead and start?
I don't have any questions at this moment, so if you have something to go ahead and start from the live video, that's fine with me.
Okay. So the first question is for you, Julie. Can you talk to us about what the term monitoring means when you say you're monitoring 28 people? And now you don't have to repeat the question. This is a change.
Right. I'm so used to doing that. I probably will do it. So when we refer to monitoring, these are individuals that are either being quarantined, and so we monitor them daily, meaning that we check in with them as far as symptoms. We want to make sure that they're taking their temperature every day, and we're asking them if they have other symptoms. These are also contacts of people that have tested positive.
Okay, so people we think might have greater risk or have been exposed, correct?
Yes. Mm-hmm.
Okay. All right, and then the next question, do you have any updates on the condition of the two people who are currently hospitalized?
I do not at the moment. I know that they're still in the hospital. I don't know about their exact condition, but we can get back to you on that.
Okay, thank you very much.
I do have a question now, if that's okay, Vivian. My question is for, not sure if this would be better answered by Julie or by Officer Muldrip. There is a lot of concern over staying at home versus going outside and getting exercise, such as going to the golf course or walking around on the trails around the outside of the park or around town. Can you kind of give us an idea of what's expected and what you would suggest from your point of view?
Yeah, so we encourage physical activity, and especially outside. I know I do it by myself. So we definitely encourage that, but more so we encourage social distancing. So you want to make sure that you're keeping 6 feet between you and another person, and you're not in a group. So just really encouraging those things. But yeah, get outside, enjoy some fresh air and sunshine when we have it.
I may chime in on that too. I know we at the COVID line, as well as at the police department, have had some calls wanting to report that, you know, there's a group of people walking in the park or people talking together, not 6 feet apart. I think everyone needs to understand that that isn't a law. That is the recommendation. That is a best practice. You know, if there were an organized party that was going to draw more of a crowd like that, we as a police department would probably get involved and go down and recommend that they not do that and encourage compliance with the order. But people walking in the park, people out talking that aren't exactly 6 feet apart, we're not going to necessarily take action on all those. I don't think we would be able to have the time. I just think it's important for the public to understand that.
And would this be the time for kind of people to step out and maybe give that guidance to each other? I've seen folks who kind of go in for a handshake and the other person will say, oh no, we're not doing that right now, and kind of have that gentle reminder. Can you recommend some things like that?
Yeah, absolutely. Yeah, go ahead.
No, I think I would encourage that, and we want to do this together. I think in a polite and neighborly way, which I've seen a lot of. It's a good reminder for each of us. Julie?
Mm-hmm.
Yeah, I echo that. It's a habit to want to reach out your hand and shake somebody's hand, but instead, you know, if you can just acknowledge each other with a wave for now, that's what we're recommending.
Mm-hmm. Can you give a little bit of guidance about how residents or businesses and business owners can find out more about that list of essential services, or what that means? Is that on a website?
Yep, you can find that at our Riley County website, Riley County Health Department website, rileycountyks.gov. There's a COVID link. Click on that. There's lots of information there. So we encourage you to go there, especially to get reliable, valid information.
Okay.
Vivian, may I ask a question?
Yes, please.
Julie, is there any evidence of local community spread at this time?
Not at this time. All 8 of our positives so far have been travel related. So we don't have any evidence at this time.
Thank you.
Can you talk again about what community spread means, what that term means?
Sure. So it's basically when we cannot connect it to travel outside. When we can't connect it to anything, we can assume that there's community spread.
Can you talk a little bit about pending tests? The question specifically is for Fort Riley personnel, and I know there are some, Fort Riley personnel, if they live in Riley County, then they're considered our cases. If not, can you talk a little bit about that process as it relates to the health department?
Sure. Yeah. So we do work very well with Fort Riley. If they have a resident that is that's a Manhattan resident, considered Riley County, that is part of Fort Riley, we consider them ours, and we will work with Fort Riley to monitor them.
I think this maybe one final question. There's been some information about peaks and curves. Can you talk a little bit about where we are now as a community and what we can expect maybe for the next month?
Yeah, so unfortunately, we haven't hit our peak yet. It is estimated that maybe toward the end of the month or early May. That's why I really wanted to lead with something a little bit more positive to keep us thinking optimistically about the future. There will be a light at the end of the tunnel. We may not be able to see it right now, but it will be there. And that is when it is predicted at the end of the month.
Okay. Thank you all so much for being here. We will do this broadcast in the same manner again tomorrow and every day at 4:15 except Sundays. And feel free to reach out and let us know if you have questions. Continue to practice good social distancing and stay home, save lives. So thank you so much.